Yeah. I think the first thing to say about the symptoms is to all women, it's not in your head. If you're feeling something, it's definitely happening, because a lot of women will, or other people might say to them, oh, it's just because of this or because of that. But women are very intuitive and they know with their bodies, like what you said, that there's something wrong. They know something's changed. However, what I think a lot of women are doing is they're kind of waiting for the hot flushes to start or their periods to stop before they're saying, oh, I must be perimenopausal or menopausal. And I think what I see is a lot of these symptoms are starting way before there's actually any change in your periods. And women are having symptoms like if they're waiting for hot flushes, say, for example, then you need to understand that 25% of women won't even have hot flushes.
Welcome to Midlife Answers. I'm Rachel Fortune. This is the podcast where we cut through the noise and focus on one real question at a time, sharing clear answers and practical next steps that fit into real life. If you've been wondering, is this perimenopause or just life? Today's question is for you. How do I know if I'm in perimenopause, and what symptoms shouldn't I ignore? For many women, this stage doesn't look like we've been taught. It's not always hot flushes or missed periods. It can be anxiety, exhaustion, brain fog, changes in mood or sleep, and a nagging sense that something just isn't right. To help us make sense of it all, I'm joined by Dr Sharma, a GP specialising in menopause and women's health. Together, we're going to bring clarity. How perimenopause actually shows up, which symptoms matter, and what your next step should be if you're starting to wonder whether this could be you. Thank you so much, Dr. Sharma, for joining us today. And we're going to jump straight in with the first question. It may seem an obvious one, but in the context of this question today, I think it's important. So, what is perimenopause? And for someone like myself, someone in their early 40s, could I realistically be in perimenopause now?
Yeah, I think that's a great question. I think it's really important to understand what perimenopause means first. And the way to answer that is to go back to understanding what menopause means first. So menopause is when you've not had a period for 12 months. That's when you are in the menopause. And what perimenopause is the period leading up to that, which starts when you first start with your symptoms and it ends when you've not had a period for 12 months. So that whole time is termed perimenopause. So usually kind of it's a retrospective time. It's interesting that most people will think that perimenopause is, in women in their 50s. And it's just really important to understand that it can happen at any age. And the majority of women, it will happen around 50, 51. Of course, there'll be some people that are a little bit earlier, some people that'll be a little bit later because we're all different. There'll be majority of women from 45 onwards. That's usually when I would say should expect perimenopause. There's always going to be some women that will be between 40 and 45, and they say about 1 in 10 women will start their perimenopause around that time. And then you've also got those women who start their menopause below the age of 40. That's got a whole different terminology. That's termed premature ovarian insufficiency. And we used to say 1 in 100 women would go through that. But actually recently, the latest data has actually increased that figure to about 3.7 out of 100. It's a little bit higher now, and including a lot more women. And in this group of women, you've got women who will just go through it. Majority of the time, there's no reason found, but for a small number, it might be a genetic cause or it'll be a surgical cause or because they're on treatments, like for endometriosis or things like that, or had surgery or damage to their ovaries. So when you say, could it happen in your 40s? It could, absolutely. But also it could happen at any age. And I think that's why, if you're just thinking that's going to happen in your 50s, then you're going to miss the symptoms. And this is why we just need to kind of, I really would like women 40 onwards to start thinking about it or knowing about it or, looking out for some of the symptoms, just so that they're prepared and it doesn't get missed.
Well, that's the thing. I do think perimenopause is much more out in the public domain as a term. But like you say, it's knowing those symptoms. So can we go and talk about those symptoms? We mentioned in the intro about missed periods or hot flushes, but there are many, many more symptoms that women can go through. So could you talk about a few more common symptoms that are often overlooked?
Yeah. I think the first thing to say about the symptoms is, to all women, it's not in your head. If you're feeling something, it's definitely happening, because a lot of women will, or other people might say to them, oh, it's just because of this or because of that. But women are very intuitive and they know in their bodies, like what you said, that there's something wrong. They know there's
Yeah.
something's changed.
Hmm.
However, what I think a lot of women are doing is they're kind of waiting for the hot flushes to start or their periods to stop before they're saying, "Oh, I must be perimenopausal or menopausal." And I think what I see is a lot of these symptoms are starting way before there's actually any change in your periods, and women are having symptoms like if they're waiting for hot flushes, say, for example, then you need to understand that 25% of women won't even have hot flushes. Yeah, if you say to yourself, I can't be in perimenopause because I've not hot flushes. And the best example for that is I can give is myself when I was going through perimenopause and I was just having low mood and I didn't really have any other symptoms. And interest is so funny that my husband recognized it because he was working in the menopause field at that time and he was saying, "Oh, no, no, I think you've got perimenopause." And as I clearly had no knowledge at that time about myself or about menopause, and I didn't recognize it in myself. So I was waiting for the hot flashes. So this is why if you're waiting for a particular symptom to start or my periods to change, then you're going to miss it. But what I do see is a lot of women having changes in mood, that exactly what
Hmm.
you were saying, anxiety, a bit of low mood. They may feel like they're beginning to not be able to cope with things, the things that they juggle life, work, friends, and they've got kids and trying to juggle everything. And they just find that they're struggling with that. And their
Hmm.
sort of tools and skills that they used to have before to manage things will start dropping. And it will be because of low mood. It will be because of anxiety. It may be because of poor sleep, getting up a lot more to go to the toilet or maybe having hot flashes as well. That can also impact it. But also, perimenopause does make you wake up early in the morning and then not be able to get back to sleep.
Hmm.
So then it has those ripple effects on the next day. People may have joint pains. They may have sexual symptoms like they would have lost their libido or they suddenly got vaginal dryness or soreness down below or recurrent urine infections. Sometimes I see women and the only symptom they have is just recurrent migraines, especially if their migraines were related to hormones. So you can see then, and they don't, and the other thing about these symptoms, they don't all come nicely packaged at the same day
This is
as
the
they
thing, yeah.
perimenopause. Yeah, you may have a symptom for a couple of days and then you may feel fine. And then, a couple of days later, you may have something else, or a couple of weeks later, you may have something else. So I think that's why it becomes really difficult to work out what's going on. But the main thing that women will notice is that there's something different about themselves. So I think it's being aware of your body, being aware of the changes. And if you're someone that tracks your cycle regularly, you'll notice straight away. If you're someone that's got a lot of energy and suddenly you've got, feels like someone pulled the plug out of you and you can't cope with your norm if you're finding that you can't cope with your normal day-to-day things because some of these symptoms, that's the time then I think you should be kind of looking at it and saying, "What's going on here? I need to maybe see somebody about this."
And get some support. Just sticking with the symptoms for a bit longer, I was scrolling through social media, which can be positive and negative in equal measure, especially when it
Sure.
comes to truth around perimenopause and what symptoms. But maybe you could set kind of it straight. Hearing loss, is that a symptom that you're going into
Yeah.
perimenopause?
Yeah, I think estrogen is implicated in some parts of your hearing, and so definitely, one of the things that women can get during pregnancy is a condition that affects the ear, but that's because of high estrogen. So
Okay.
I haven't really heard anybody saying that. What I have heard is definitely tinnitus or that ringing in your ear.
Interesting.
To me, if someone's got hearing loss, I don't want to just label it as perimenopause. I'd want to show
Sure.
and investigate that. That would be a symptom for me that I'd be quite concerned about.
Okay, that's really good. Thank you for putting that straight because, like I said, I got it off social media. So
Mhm.
you don't know what is fact or fiction. So it's really good to get your opinion on that. With symptoms, I think as women, we're very good at just pushing through and getting on with the day, or sometimes not having the time to really stop and think about what we're feeling. But are there certain symptoms where you think that actually we shouldn't be ignoring this and we do need to go and get some more medical support?
Yeah, I mean, absolutely, women are like that. We just get on with things, put it to the back of our minds. There are some symptoms that would make me worried, and one of the most important ones is that really heavy, irregular bleeding.
Okay.
Now, yes, that definitely happens around perimenopause, and to be honest, anything can happen to your periods. They can either become very light or very heavy. They can become further apart or close together. And then every month it might change as well. So anything can happen. But for me, heavy bleeding, especially associated with pain or and happening outside of your cycle, should really be checked out just to make sure that it's not something else. And you want to make sure it's not an infection or polyps or fibroids or some other
Hmm.
condition that may be causing it that you would miss if you just labeled it as perimenopause. So that for me, I tend to usually examine people, ask a few more questions around it, and then I may organise a scan if I'm not sure what's going on. The other things that I worry about is if someone's got like that really persistent kind of low mood and it's beginning to affect their day to day life, maybe making them feel a bit suicidal or thoughts about harming themselves, and that you must not ignore. And again, of course, it could be perimenopause, but of course, it could be also um, clinical depression. And so
Sure.
we need to keep an eye on that. The other things that I would investigate for other things would be heart palpitations. A lot of women get that with associated with hot flushes, and it's just your heart kind of pumping to push the air, sorry, not the air, the blood to the surface of the skin. But also, women will wake up in the night and then they will just be really aware of their heart beating really fast. For that always needs investigating as well. Would you want to do an ECG? You would want to just make sure someone's checked your thyroid function. And then that poor disruptives, because I think like once the key symptom for me is sleep, then that will have such a impact on the next day. And if it's
Hmm.
repeated every night having poor sleep, your body can only take a short period of that. But with perimenopause, it just goes on and on and on. So and because that affects what you eat, it affects your energy levels, it affects your brain function. Make and it impacts all the choices you make then in your life. So you may be reaching for the wrong things to eat, you may be putting on weight then, you may be, I don't know, not exercising, not going out, not doing your normal things. So that's to me is a really important symptom that if your sleep's impacted, and it's not just at perimenopause, but at any time that you should really be.
It,
Yeah.
it's a form of torture, isn't it? Sleep deprivation. So
Oh,
it's
absolutely. Yeah, absolutely. One other symptom that I would just, always want to mention is any sexual symptoms, because I know that's something like when I speak to my patients, like, they'll tell me about all of the other symptoms, but they won't mention the sexual symptoms, and it's only when I will ask them that they will start talking about it. So, be brave, go in there, and if you've got sexual symptoms, make sure you're talking to somebody about that.
just a quick one. If you love Midlife Answers and want to support what I'm building here, you can buy me a coffee or a green tea for people that know me. It helps with the behind the scene costs and means I can keep bringing you these honest midlife conversations. The link's in the show notes. Thank you. Okay, so two questions I would love to ask. What do you mean when you talk about sexual symptoms? And if I just flow straight on, when you come and talk to a doctor, what is the best way to talk to the doctor about these symptoms? Because you get such a limited time talking to someone about
Yes, that's true.
your health, so could you give a few tips on what we should maybe prepare beforehand or what we should be saying on the day when we actually ask for that support?
By sexual symptoms, I mean, in the pelvic floor, bladder, vulval, vaginal area, definitely sexual processes as well get impacted. So women get low libido, they get reduced arousal, they can have weaker orgasms, they can get bladder infections, pain when passing urine, pain during intercourse as well, and then
Yeah.
the whole pelvic floor becomes weak, so you can start to get prolapses. So that's the kind of symptoms that I'm encompassing about those. How to talk to your doctor? I think the best way is to list all of your symptoms, first of all.
Okay.
Just to recognize, have a good look at all of those areas. What is everything working okay? Try to describe what you're feeling in your body, and they'll always want to know how often it happens, whether it hurts or not, and what kind of situations these kind of symptoms come in. But I think if you list the symptoms and you book an appointment, my first thing that I would always say, because of limited time, just book a double up. Just, you're absolutely allowed to do that at GP practices. I think if you give yourself 15 minutes to talk about really important symptoms like this, then you're kind of setting yourself up for a quick, this is what I've got, and then hit, okay, here's what you need, and off you go. So it just gives the doctor a bit of space to maybe explore some ideas and explore some other things that may be linked to it. They may want to ask you questions about perimenopause, and they may want to talk to you about what's going on in the body and give you some education about what's changing in the body. Well, that's what I would want to do anyway. And then I'd want to talk about the treatments. I may need to examine as well someone. So you just need to give yourself a bit of time with those things. And I think that's the best way. Is just list all your symptoms and then tell the doctor these are the things, and also how it impacts you in your life. Because I think that's where it puts all of those symptoms into context in of someone's life, and then it's easier to understand then how that's affecting someone, when they're going through their day to day life.
So go in as prepared as possible. And I love the idea of booking a double appointment. I had no idea you could do that. So that is really good to know that you can request that
Yeah,
from the outset.
absolutely.
That's fabulous.
Yeah. Yeah.
Can we touch on blood tests when it comes to perimenopause? I've had a
Oh
few
yes.
friends. I've had a few friends have their bloods taken to determine whether they're going through perimenopause or not. I've also heard that perimenopause is more symptom led. So I would love to get your opinion on whether blood tests are worth following up at this time of our lives.
Absolutely. Every woman will want to do blood tests to check their hormone levels, and that's a given. The difficulty is when you do these blood tests, the problem is the hormone levels are fluctuating. And whenever you're doing these blood tests, then people will invariably, or what I see is that they're mostly normal, because it depends when you do them, and they can change hour to hour, day to day. Of course, and it's really hard to rely on them. And recently there's been a document out from the British Menopause Society looking at all the research about blood tests, and they're just saying that measuring estrogen levels and FSH levels are inaccurate, and it really don't reflect what's really going on. So the emphasis is to base your diagnosis of perimenopause on someone's symptoms rather than on blood tests. There are some caveats with that. A couple of things. So if you're below the age of 45 and you've got some of these symptoms, I would want to do some blood tests. One, because below the age of 40, you need to have some of these blood tests done to make the diagnosis. So below the age of 40, but between 40 and 45, you don't want to miss like a thyroid problem or a vitamin deficiency or some kind of anemia that may also give some of these perimenopause symptoms. So it's worth just doing some blood tests in those people. Again, if you do hormones in them, they may come back normal. So, and this is what's happening. So women are doing these blood tests and they've got a long list of all of these symptoms, and they're doing the blood tests, and then the GPs or doctors, whoever's doing them, looking at the blood tests and saying, actually, these hormonal levels are all normal. They just get sent away. And so I know that women want to do the blood tests, and it's difficult trying to negotiate that with someone to say, actually, it's pointless because it's not going to change my management. I need to look at the person in front of me and what symptoms they have. So what I tend to do is I also like using my consults initially as a way of doing a pit stop with women and looking at their overall health, general health, and what they're doing with their lifestyle. So for me, I use the blood tests, check their cholesterol, check their vitamin D, B12, folate, iron level, because these are things that are so frequent and common that you see in people that can absolutely make you tired, give you a bit of low mood and energy. And so these are easily treatable as well, and thyroid issues as well. So they're easily treatable. So you can make a difference in with some people. So it's just really good to know all of these numbers. So I use that initial appointment as let's do a general check on your health. Usually don't add the hormones, but if someone's really insistent, then I will. But I'll have to say to them that if they're normal, then it doesn't mean that you don't have perimenopause. It's getting away that attachment that I need a blood test to make the diagnosis, and actually you don't need it. The focus is on the symptoms, and that's why listing all the symptoms and writing all these things down, then presenting that to a GP, it makes it so much easier, I suppose, than for the doctor on the other side to say, oh, okay, clearly this is perimenopause. let's get you started rather than sending you away, and saying there's nothing wrong with you.
Exactly, but the bloods are showing different. So blood tests definitely have their place, like you say, but it's going back to that
Yeah.
tracking and writing everything down. And that's a longer
Yeah.
process, but it's a more accurate process.
Absolutely. Yeah.
Can we finish up, Dr. Sharma, with some clear advice going forward? If people are listening to this today and thinking, I am definitely relating to some of those symptoms that had just been mentioned, or I'm of an age where I should be more aware of what's going on within my body, what's the first practical step you should say to people going forward? What can they do as of now to prepare themselves as much as they can at this stage of their lives?
Yeah. I think the first step is always just being more aware of your body. I think,
Yeah.
we're so busy, we're not even focusing sometimes on these things. And sometimes just taking a step back and checking what's going on in each part of my body. Start at the top and work your way down. And,
Yeah.
is what's happening to my skin, hair, my weight, my sleep, my joints, my mood, just going through all of these things. And I think there's some great menopause symptom trackers out there as well.
Great.
You can just Google it and lots of them will come up. And if
Great.
you just kind of have it will list all the symptoms that people have in perimenopause and you just start ticking, like, which ones do I have? Sometimes it's hard to kind of do the body scan and work out what's going on, especially if you've got symptoms here and there. But just have a look at the symptoms and then you'll also know, it's about being more aware of what symptoms do people have in perimenopause as well. So then you'll be more aware of that as well and what to look out for and what to, yeah. And if you've got any of the symptoms that I mentioned that were a little bit more serious, like the heavy bleeding, palpitations, sleep problems, mood changes, then definitely just go and see your GP. And I think once you've done the symptom tracker, you'll be clear yourself whether, yes, I am in perimenopause or you're not. And then you can take that symptom tracker, book a double appointment with your GP and go and talk to them about it. And then they'll be able to talk to you about what to do next and how we can manage this, all different ways that you can manage perimenopause.
That's fabulous. Thank you so much, Dr. Sharma. I know this is your lifelong passion, talking about perimenopause and menopause. So to try and get as much out of you in the short space that we have, I really appreciate everything that you shared. As I mentioned in the
Thank you for
intro,
having me.
no, it's a pleasure. And as I mentioned in the intro, you are a women's health specialist and you do a lot of work around perimenopause. So I will put your contact details in the show notes so that people can reach out to you and contact you directly. But thank you so much for your time today. I think it's so important that we have normalized this conversation, put it out there in the public domain again, but also reassured the women listening that what we're feeling shouldn't be ignored and there is help out there for when we need it.
Absolutely not. Yeah. No, it's definitely not in your head. And when you feel something, it's definitely there.
Absolutely. Thank you so much for today. If there's one thing to take away from this episode, it's that noticing changes early and taking them seriously can make a real difference. Perimenopause isn't something to push through in silence, and you don't need to have all the answers before asking for support. Thank you so much to Dr. Sharma for bringing clarity to a stage of life that can feel really confusing and isolating. For those of you who have been with me for a while, you might recognise Dr. Sharma from a previous conversation I had with her and her business partner, Dr. Wright. Called Menopause 101, we explore a wider range of topics around perimenopause and menopause, including crash menopause, testosterone, sex and intimacy in midlife, and so much more. The link to that episode is in the show notes, and it's well worth a listen. If you found this episode helpful, you might like to follow or subscribe to Midlife Answers and share it with someone who could use a bit of reassurance right now. And if you'd like to support the podcast, remember you can buy me a coffee or a green tea. It really helps keep these conversations going. The link to this is also in the show notes. Thank you so much for listening today, and please join me next week when I'll be talking to therapist Suzette about burnout in midlife and the importance of recognising the early signs before it becomes something we can't ignore. I look forward to seeing you then.